COVID cases do continue to climb once again in South Dakota.
Today, the health department reported 989 new cases of COVID-19. Active cases are up over 11,100, but more than 29,000 people have recovered.
Trials on a number of vaccines continue all around the country, and South Dakota health officials are taking steps now to prepare for a vaccine rollout. Today, they discussed everything from transportation to distribution. Austin Goss with our top story tonight from the Peer Newsroom.
South Dakota is preparing to distribute thousands of COVID-19 vaccines over the course of the next few months. The Department of Health told medical professionals from across South Dakota today that they intend to get the vaccine out to certain at-risk populations first.
We do have preliminary information that considers vaccine allocation and priority populations, information to include healthcare personnel, long-term residents, and potentially individuals with specific underlying medical conditions which increase their risk for COVID-19.
South Dakota and other states around the country are preparing for the possibility of receiving a limited amount of vaccine initially, and how those doses will be distributed.
Created a framework for equitable distribution, and that's based on many factors that will be included in our state plan. Those factors will be looking at many different things: the number of doses that we've received, what is that priority population, where do we have a high incidence of COVID, and individuals that are at a higher risk for getting COVID.
State health officials aren't sure how much a COVID-19 vaccine will cost.
We know it's being worked on. I can tell you that with VFC, we have a regional cap of $20.73 for a dose of vaccine administered. I don't know if it's going to be something similar to that, if there's going to be regionality to the amount that can be reimbursed, or if it's going to be one national amount. We know they're working on that. We just don't know what that dollar amount is.
As millions get their flu shots, health experts aren't yet certain if the flu vaccine and a COVID vaccine can be received at the same time.
The first answer was absolutely not. It's not. They're not being studied together. However, they've now said that if it's an unadjuvanted vaccine, you can give it at the same time in opposite arms. I think we'll have more definitive information from the ACIP. I'm sure they're going to discuss that and address that when the recommendation comes out, because it is a very important piece of information right now.
The state still does not know how many vaccines will be distributed in Phase 1. But believe that it will be distributed based on population. In Pierre, Austin Goss, Dakota News Now.